Does ACL reconstruction reduce the risk of knee replacement compared with the non-operative care? That's the million-dollar question. It's the Sunday paper roundup where I read the paper so you don't have to. And this week we have two papers from two different journals to help move that conversation forward. For years, the discussion around ACL surgery has focused heavily on the risk of operating and the prolonged rehab, and that's appropriate. Surgical intervention does carry a very small risk, but what's often underplayed is this: non-operative care also carries risk. The main concern is ongoing functional instability and injury. Repeated giving away episodes don't just cause symptoms, they increase the risk of secondary meniscal injury and cartilage damage, and that can accelerate osteoarthritis over time. So paper 1, from the American Journal of Sports Medicine, the AJSM making its debut on the Sunday paper roundup, a recent systematic review and meta-analysis showed that earlier ACL reconstruction was associated with a lower risk of developing long-term osteoarthritis compared with delayed surgery. The signal was consistent: less OA when surgery is performed earlier rather than later, and patients who avoided arthritis were on average operated on months earlier. This challenges the idea that timing doesn't matter. Paper 2, another debutant, the Arthroscopy Journal, an accompanying editorial commentary reviewed a large registry study of nearly 12,000 patients. The key finding in plain English: patients who had ACL reconstruction were about half as likely to go on to need a knee replacement compared with patients treated without surgery. The absolute risk in both groups was low, but the difference between them was meaningful. So how does this fit with what we already know? Well, the landmark Froebel trials, New England Journal of Medicine 2010, with longer-term follow-up published later, certainly showed that some patients can cope well without early surgery, particularly in the first couple of years, if they're not experiencing instability. What this newer study suggests is this: when instability persists or when surgery is significantly delayed, the long-term cost of the joint may be higher. So what's the take-home? This does not mean everyone needs ACL surgery, far from it. But it does mean that we need to be honest about both sides of the equation. Surgery has risks, but so does non-surgical care, and we have to be aware of this. And prolonged instability is unlikely to be biologically neutral. So what's my verdict? Well, you should really consider both of these papers strongly, not as a blanket rule, but this is now a conversation we should be having with our patients, not just about return to sport or short-term function, but about long-term joint health. The answer isn't absolute, but the evidence is increasingly pointing in this direction. Make sure to follow next Sunday. I'll keep breaking down the evidence as it lands. Canada.